Good afternoon once more. It is time for us to get started. But before we get started, I would like to just introduce myself to you. My name is Kudani Mukoma. I am a lecturer and a researcher at UNIVEN, or the University of Venda. I'm also a lead researcher of a project that we are undertaking at SMRC of its DPHRU. And I think my experience conducting both qualitative and quantitative research has brought us to this session today, where I'll be sharing my insights or knowledge regarding qualitative data collection for health research. And for this session, I'll be covering the techniques, tools, and best practices in order to ensure that your data collection is of good quality. Okay. So this is just an agenda on the key things that we'll be touching on today's talk. And with our session today, I would like us to keep it as engaging as possible. So I will allow for some questions during the talk, as well as we'll have like a breakout session towards the end of the presentation. But I would like us to use the chat box to keep interesting topics going, and then we can try and respond to them. So before we just delve way deeper into the data collection process, I would like us to talk about why qualitative research matters in health. And we know that in healthcare, usually whether it's professionals or it's researchers or even students in training, they will have to make some contact with patients. So these patients come to these professionals or come to these facilities in need of assistance. So qualitative research has been widely used to understand patterns of health behaviors and to describe lived experiences, as well as developing behavioral theories, which are useful to explore the healthcare needs and designing interventions to help these patients or people in need of these services. So because of this, there has been a need for us to deepen understanding on patients' experiences, uncovering what are the social determinants of health, and provide cultural context in relation to how health should be perceived or how adequate healthcare should be provided. This will also touch on basis of the practical applications. So, for example, it might not be necessarily a case where a certain intervention or a certain vaccine is developed and it seems useful for specific cultures, and then to some cultures there might be just some cultural barriers that will hinder the vaccine uptake of such a specific vaccine. We saw this during COVID, where a number of people had issues of vaccine hesitancy because of their cultural beliefs. It also is very useful in enhancing patient-centered care. So this means that now the care that will be delivered will be focused on the needs of the patients, and also guiding the health policies and systems so that there could be improvement in their delivery. So in a nutshell, we can be able to get all these insights or be able to come up with ways to improve healthcare delivery through data that we have collected qualitatively or using a qualitative research. So what is qualitative data? So qualitative data refers to non-numerical information which we will be using to understand what I've just said previously, which is the experiences, behaviors, emotions, and perceptions of individuals who are of concern. So this type of data is rich and is descriptive, and it often involves the interpretation of themes and patterns of health behaviors to describe illness experiences, as well as, design health interventions and develop healthcare theories. So there are various types of qualitative data, which is textual, verbal, visual, and observational. So in this case, we will be focusing more on the data that we call verbal. So here, this is where our participants are engaging with us and they are giving us feedback or giving us insights so that we can be able to understand their opinions or experiences. So qualitative data collection involves a number of things, but it's quite important to understand that the ultimate strength of qualitative data, or qualitative approach rather, lies on the richness of the data. This means that the more the descriptions about a certain phenomena or a certain condition, the more the depth in exploring what it makes and how did it come to be. So the more we engage with participants, the better are our chances of us having a complete understanding of what is happening. So qualitative data collections involves recording, interpreting, and analyzing data to uncover deeper meanings of human experiences and behavior. And there are some major types of qualitative data or qualitative research. And this includes narrative research, phenomenological research, grounded theory research, as well as ethnographic and historical, as well as case studies research. So the data collection in qualitative research includes in-depth interviews, where now it's a one-on-one engagement with a specific individual or individuals who are affected by a certain condition, could be mental health issues or any chronic conditions, as well as with with groups. And this would include focus group discussions to discuss certain observations, share narratives, as well as getting insights on how their experiences has been. We also have what we call narrative life history, document analysis, audio materials, videos or footage, as well as text analysis and simple observations. So all this kind of data is falling under qualitative data, and we can be able to tell how the experiences of people, or how the living conditions, or how certain problems have been affecting people in general. So there are three popular methods that have been used for qualitative data collection. And mainly these are FGDs, which are focus group discussions, and one-on-one in-depth interviews, as well as participant observation. So for this session, we're going to focus on the two main data collection methods or approaches, which is the in-depth interviews and also the focus group discussions. So these approaches utilizes what we call a semi-structured interview guide for data collection. And I'm going to talk a bit more on the semi-structured interview guide so that I can share some more understanding with regards to this. And why do we call it semi-structured? So a semi-structured interview guide is a short list of guiding questions that are supplemented by follow-up and probing questions that are dependent on the interview's responses. Or rather, you can say it's a flexible but guided interview format that uses a combination of predetermined questions and has room for spontaneous exploration based on the participants' responses. So what this means is that the questions that will be developed by the researcher are mainly there to guide or to initiate the discussion with the participant, and therefore the participant has an opportunity to bring even further insight or go even deeper by bringing up new things. So this is quite useful and it's quite important, because in that way, the researcher is not the one who's, sort of like leading what should be the things the participant is saying. The participant is able to spontaneously, bring out what we would be needing from them. So in this fashion, we use the researcher has a set of key topics um, or questions, but the order and phrasing can change depending on how the conversation is going. So this means that we don't necessarily, just go with how the structure of the question has been designed. It means that if the conversation is going and more things are coming out without the researcher asking, we allow that to happen. And then from there, we focus on things which were probably not been, mentioned or discussed. Hence the spontaneous exploration. But then there are certain things which are quite important, when you're having or using an interview guide. So number one is to ensure consistency. By ensuring consistency, you trying to ensure that you capture as much data as possible. And if there is not enough exploration, that means that there will be a lot of data which will not make much sense, or which would not necessarily give you that insight into understanding what is happening. And so this tool or this guide should be designed in a way that it ensures consistency, explores the complex issues, and also facilitate what we call in-depth understanding. So you must be in a position to now say, okay, you understand the experiences that a person living with high blood pressure is dealing with on a day-to-day basis. So I had an example there just to bring some context into this, just to say that in a study of chronic illness, an interview guide can help explore not only the medical aspects, but also how the illness affects daily life, relationships, as well as mental health. So this just shows you that this guide should be able to go even a step further than what we would be looking at. So we are able to grasp or get insights of various levels of a person's well-being and living experiences. So that tool should be, or the tool should be able to capture all of this, or should be able to put to allow a participant to bring out all these issues all at once. So there are certain key components for an interview guide to be, well structured, or to say that this is a very effective interview guide. So number one, the interview guide should have a good introduction that promotes rapport building. So this means that it should promote, engagement with the participant that will be involved. It should have some certain components that captures demographic information. So we know that in quantitative research, you actually would ask the participant to complete their gender, age, and things like that. But here, obviously, you can, when on the start of the discussion or interview, you can highlight, if it's an in-depth interview, that this is an interview with Gudani, who is a male, and is apparently healthy, and is from this sort of background, so that you can have some sort of context when you are, when you are looking or analyzing your data. So It should also involve or include core interview questions. And these questions are the main questions. These are related to the research focus, typically, framed to elicit responses to capture the richness or to capture rich data. So this would include you having a specific research question that you would like to answer. For example, let's say you want to um, explore, perceptions towards vaccine hesitancy. And therefore, that means that the core questions here will be focused on, their experiences with, taking vaccines. It could be whether it's vaccines for COVID or vaccines in general, whether it's immunization and things like that. So when you do this, this will enable you to now have a much more detailed and in-depth understanding of what could be the cause of, them having such hesitancy towards vaccine. And then these main questions will also have follow-up questions or probes. So the probes are helpful or useful for now. Let's say that the participant has given you information, but you can see that they have not necessarily elaborated, or some things are not quite clear as you would like to. So the follow-up questions or probes are useful for getting clarification. And I would like to say that a good example with this is when, participants are now using what we call day-to-day words or communications. For example, in Soweto, they would refer to, a bunny chow as a quota. So for some people, that might not necessarily mean much, or much would be clear, if I can put it like that. So therefore, there's a need for you to probe and say, okay, would you tell me what a quota is, or what do you mean by a quota? Things like that. So this would be very helpful, so that, when you now analyze your data, you can actually put how the participant actually explained what it means to be having such a thing. And then that would be followed by closing up questions. So remember, the closing up questions are quite important. So to see, or to hear from the participant's perspective, if they've fully, given you everything that they needed to share. And this would allow you to, make sure that there's not anything that has been missed out, in case maybe you as a researcher did not think of these issues when you're putting down your questions. So you can always allow your participant to share even greater insights, or even more things that you did not necessarily ask. You can also ask for for things like recommendations that they would like to, share, so that you can improve on what you already have. Right. So now I want us to talk about the practical tips for designing a health interview guide. So there are a number of issues which are quite important to note when designing this kind of guide, and this will help us, structure or develop interview guides which are, useful and also effective in getting what the kind of data that we're looking for. So the number one key thing is to ensure that the guide has open-ended questions. So open-ended questions allow for participants to share detailed responses in their own words without being restricted by a yes and no answers. So remember, qualitative data collection is all about listening to what the participant knows about that specific topic. And it's not necessarily, looking for insights from the researcher. So as a researcher, you pose the question, and therefore the participant has to now share as much knowledge as they can on that specific topic. And a good example of an open-ended question would read somewhere like this: how has your illness affected your daily life? And rather than saying, has your illness impacted your daily life? Because if you ask it as, has your illness impacted your daily life, that would require a yes or no, it has not. But if you say, how has your illness affected your daily life? Then this person is now able to tell you that, oh, look, so ever since I got this illness, I have no longer been, able to carry on with my daily duties. For example, I'm no longer working, and this has affected me financially and things like that. So you see, you get to have the different elements that, this one condition has actually impacted on this individual's life. You should always maintain neutrality. So this means that you keep questions to be non-leading and neutral to avoid influencing participants' responses. So the data we're looking for when we conduct or when we undertake, qualitative data collection are, data being shared by participants. This means that, you know, you do not, as a researcher, you do not lead participants into answering what you think could be the answer. It's important that we get the views of the participants as much as possible in order for us to now say that we have explored, this phenomena or this issue. So to avoid, leading questions, such as, those that imply a right or a wrong answer, and that could be something like, don't you think that could be the reason why you are no longer, eating healthy? Or wouldn't you agree that, you are late for work because there is no transport available for you? Those kind of questions are leading questions. In a way, you've suggested that the participant is late because there's no transport available during the time that they have to. So they will obviously say, yes, I think that's the reason. So those kind of questions are not good because therefore you do not get the kind of data, or you do not necessarily capture the experience of the participant as it's supposed to be. So it's always quite key that you use clear and simple language. So, you should just ensure that the language used in the guide is accessible to participants from diverse backgrounds, avoiding, jargon and medical terms unless the participant is familiar with them. So obviously this is quite dependent on, the participants that you're having. If your research is focusing on the general public, I say using, simple and day-to-day language is much more practical, because therefore they are able to relate to, such language much easier. So you do not want to be using scientific terms when you're talking to people in the community, because then they will not have an understanding of, what you're asking. And therefore, the responses will not be as clear, or they will likely not respond. So always make sure that your language is simple and it's clear. So be flexible as well. So while, your guide provides structure, you do not necessarily have to be rigid to it. So it's quite important that when you hear that something else is coming and which is of interest or it's very useful, you now, probe so that that can be further explored during the interview. So this would actually help even deepen the understanding and also, the richness of your data. So always pilot test. So just before using the guide, for actual data collection, it's quite important to pilot it with a small sample of participants, to ensure that the questions are clear and generate useful data. So this can help you make improvements before you actually start with your data collection. So I'm not so sure if there would be any questions, but Komoto, if there are any questions on the chat box, please just um, highlight for me in case I'm also moving way too fast. So just continuing, I would like us to now look at an example of what an interview guide is like. And here now we're going to look at, the questions, the kind of questions you can actually put, to start off. or to, develop your own interview guide. So, like I had mentioned earlier, that an interview guide, or this kind of guide, is semi-structured, meaning that you do not necessarily have to have a very long document or a very long questionnaire, because some of these, some of the issues will come out spontaneously. And I highlight that we need to focus on the main topics. So the things that you want the participant to, express themselves on, or you want them to touch. So here's a good example, or here's an example that I've put for as an example. So we start off with a good introduction. So obviously this could be changed or modified, depending on the kind of participants you're having. A good introduction is always good, a good way to build a rapport with participants, so that they can feel, welcome, they can feel, free to, know that this is not like a formal interview where everything has to be, quite formal, and therefore they feel like he's just going to be posing questions on them without necessarily, them having to express their views in their own free way. So an introduction has to be able to cover that part. So I had here in my slides that thank you for agreeing to speak with me today. This interview will focus on your experience managing, you know, so I just said condition, meaning that it could be any condition that you would like. And then your responses will help us understand how patients like you navigate treatment and daily life. So in a way, I've welcomed the participant, and I've also shared what the research focuses on. So now you'll start with your background questions. So just to start, this is in a way sort of like an icebreaker, or also just to get your participant to now, start feeling free to talk. So you always start with questions which are not too complicated, or will not cause a whole lot of emotion. For example, like, how long have you been living with your condition? And then they can start, bringing up these kind of discussions. And then you can also ask, what treatments have you received for your conditions? And then they can share with you what they've been using. And once you're done with the background questions, now it will be time for you to start moving to, the core questions. And these are questions that you want your participant to spend more time talking about. So obviously, this is where now your follow-up questions would be quite useful, or probing would be quite useful. A good example with this is like, can you describe a typical day managing your conditions? Remember, the question was that to capture or get insight into how the daily living is for participants with this kind of condition that we are investigating or want to know. So, can you describe a typical day managing your condition? And what are the challenges? What challenges do you face in managing your health on a daily basis? And how do you feel about the healthcare services you receive for your condition, as well as what type of support do you have from a family or friends in managing your condition? So with just the core questions, you've now, asked questions to sort of like explore support, and also how, the experience of the participant has been. So it's support from the healthcare services, support from family and friends, as well as their experience, while living with the conditions. And then that means that now your follow-up, questions will now be centered around these core questions. So you can now ask for more elaborations of what do you mean by support? Can you explain what kind of support you find most helpful? Then now the participant will, be able to share with you the kind of support that they mean. Is it support from their partner, and what kind of support are they giving? Is it because, when now it's time to go for consultation, or receiving medication, is it that their partner goes with them, or the partner helps to collect the medication for them? Things like that. So, and then another probing or follow-up question can you tell me about a time when you had to adjust your routine because of your illness? So now you want to understand the changes that this condition has brought on to this participant life. So obviously, if there has been, now a condition that this participant was not having, this means that their life had to change drastically and now start to make, new lifestyle choices. For example, someone who's living with obesity and has been recently diagnosed with high blood pressure would need to now start making some, nutrition and physical activity changes. So those things, if they were not done before, that means that adapting to that would, be a bit of, strenuous, or there might be issues that this participant can say about those things because they were not already used to them. So those kind of follow-up questions are useful into exploring these issues and getting more detail of what exactly is the participant saying, or what do they mean. And then you can have your closing up questions, and this kind of closing up question will be looking at, is there anything else you think is important for me to understand about your experience? So now you're trying to get the participant to tell you about those things that they think are quite important to talk about their condition, which you probably didn't ask about or you missed. And this will actually even improve much more deeper understanding of the participant's experience. And then you can also have another closing question that asks about how, if they have any suggestions for, it can either be through researchers or, healthcare providers, to improve support for people living with the condition that the participant is talking about. So these will give you, really useful data into now recommending, what could be possible interventions. And this means that the interventions that you'll be thinking about or you'll be looking into will be informed by what the people are asking for or what the participants are thinking would be useful for them. Because it's always, a challenge, deciding on what are people looking for. Or you can have an intervention which people don't necessarily, make use of because they feel like it's not meant for them. But if you now ask them about what could be the solution to specific problems and they are bringing up the solutions, then for it, the chances of them likely, utilizing the interventions are high, since they are the ones who will be part of asking for that intervention. So yeah, that is how an interview guide is like. And I would like to just move on to focus group discussions. And this, in a way, quite useful. So this kind of methodology is where now a group of people or group of participants typically, typically involves 6 to 12 people to discuss a particular topic or issue under the guidance of a trained moderator. So the key features of a focus group discussion include, group-based interaction, and this is where participants are sharing their opinions, experiences, and ideas on a topic. However, they are also not structured. So they are also, adopt the semi-structured, style of discussion. So they are moderated by a skilled facilitator. So this is the person who will now ensure that the discussion stays on track, touching on those key or topical areas, and making sure that, whatever that will be coming out is new is still falling in line with what the researcher is interested in capturing. And, the focus groups involves, or maybe just to say that how they differ from in-depth interviews is that, it's a group of people or a group of participants, who will be now, discussing on an issue which allows for social interaction and group dynamics. So therefore now you are able to, capture, multiple views of how a specific situation is affecting people. And then, the group interaction can lead to new insights as participants build on, or challenge each other's ideas. So that means that if I can share a view and then another participant would likely, share a view on that very same. It might not be the same or in agreement, but now they are engaging in this one topic, so to share their own experiences, and that is actually quite useful in now, giving an in-depth understanding of how one thing could be affecting multiple people at once. They also provide a collective perspective on a topic rather than focusing on just one individual. And I will talk more on the in-depth interview as I go to the in-depth interviews, but I just thought that it would be quite important to highlight that the differences. So when do we use focus group discussions in health research? We use focus group discussions when we want to explore group-based participations and attitudes, when we want to understand the social dynamics and group influence, when we want to gather diverse perspectives on sensitive topics. And a good example of this could be discussing vaccine hesitancy in a community where a different levels of trust in healthcare might emerge. So this, sort of data collection is quite useful when we now trying to understand, issues that are affecting community-wide, or communities, or affecting, villages or towns, or, a larger scale of people. This kind of data collection is quite useful for that. And it really, allows a researcher to now fully, capture what, other external influences are around, people in that specific community. So there are also other dynamics, when trying to collect this kind of data. And number one, which is ensuring all voices are heard, because, now it's a group of people and everyone obviously wants to share their own experience. It might just be a bit difficult that, they all have, the ability to say, okay, I'm going to wait for someone else to talk and then finish, which is why that a moderator is quite, has to be skilled or has to be well trained to know how to actually, engage all participants, as well as making sure that no one feels disrespected. So, for example, you can use techniques, that, directly invite those participants who are not participating in the discussion, such as like, I'd like to hear from those who haven't spoken. Does anyone have a different view? It's also, issues that, you can find one person being the only dominant person talking, and that would actually, be problematic, because then you're only hearing one voice and the rest are not sharing their insights on the topic. So making sure that a moderator is able to, take control of the discussion will be quite useful. So also, the issue of facilitating constructive discussion, which is ensuring that the space is safe for everyone and that everyone feels, well respected and comfortable, not to, think like they are of a lesser person than the other. Now, talking about in-depth interviews. So these are also not so different from the focus group discussion, but the difference here is that it's a one-on-one interaction where it's the researcher and the participant. And these are usually longer because now we're going in depth, and the details are, would, take more time. So they usually last, 30 minutes to an hour. And, the key features are one-on-one interaction. They also utilize, open-ended questions. And, they focus on gathering rich descriptive data, rather than just yes and no's. And they're also flexible as well. So by the use of using a semi-structured interview guide. So this is just the differences between the IDIs and FGD. So I've already touched on this. But I would like to just highlight that the in-depth interviews focus on, individual interviews. So it's a single participant, and they allow deep diving into personal perspective, emotions, and experiences. So this means that, for people living with specific health conditions, this kind of data will be useful as it's more private and confidential. So this means that whatever that would be confidentially shared will remain between the participant and the researcher. Unlike in focus groups where now, it's multiple participants, and therefore if anything sensitive is shared, therefore, someone else might share that data. So although we ensure that, the data will be kept confidential by the research team, it does not necessarily mean that the participants will afford the same courtesy and be confidential. So this kind of data collection is quite useful when, collecting data that is sensitive. So when to use IDIs, when you want to explore personal or sensitive topics. A good example would be, investigating mental health issues, chronic illnesses such as HIV, substance abuse, such as drug abuse, where individuals likely feel uncomfortable discussing these topics in a group. So also when you want to understand unique personal experiences, or to capture or to have deep understanding. Also when you want to explore complex health decisions, as well as, capturing unique insights from vulnerable populations. For example, if you want to capture insights from those in the LGBTQI, or the gay community, over social issues that they feel perhaps exclude them from, being free or living freely. Right. So key considerations when conducting IDIs is, building trust and rapport. So here, because it's the researcher and the participant talking hand in hand, it will be quite useful for good rapport to be established. So, you want your participants to, feel as comfortable as possible so that they can share with you as much insight as possible. And a good way to start is, start the, interview, with asking how the participant feels, and then you are able to build on that. Be flexible and also ensure that you listen very well without interjecting or, interrupting the participant. So whereas even though you'll be using your semi-structured guide, you do not need to confirm strictly to that guide. So you should ensure that there's spontaneous discussion with the participants so that they can be able to share with you freely. You still remain neutral, and you must be you must be very objective, and just avoid leading the participant to sharing things in your own understanding. And also, the issue of confidentiality and ethical consideration. You must ensure that the confidentiality is well maintained. For example, the environment where you're going to be conducting the interview has to be a safe space for the participant to freely share their insights, especially if you're talking about very sensitive topics. And also you can just talk about how whatever you're discussing will not necessarily lead to whatever that you publish to be tagged or attached to their name when you publish. For example, you're going to anonymize everything and not necessarily use their details, their personal details. And also issues of probing to deepen understanding is also quite essential for this, so that you can get much deeper or more insights on the topic that you're trying to explore. Right. So when conducting qualitative research, there are certain things that you need to consider, and these, cultural issues, ethical issues, and also methodological consideration. This will ensure that the research is compelling, sensitive, and also ethically sound. Also this, kind of consideration will also enhance or improve the quality of your data, and also as well as participant engagement. This will mean that your findings will not only be meaningful, but also credible. So there are some issues with, cultural sensitivity that you need to take into consideration. So number one if you are going to a specific, village or town, you need to understand the cultural context, and that is the health beliefs, as well as issues such as, the kind of stigma that, is attached to those, that specific culture. There are cultures that, believe that conditions such as HIV, mental illness, and other chronic diseases, just, mean that a person is either infected by, spirits, and not necessarily believing that, it's a disease. For example, in some cultures, they believe that, when a man is obese, it's a sign that they are wealthy or affluent, which is not necessarily the case. So those kind of, cultural beliefs need to be taken in consideration when you're trying to explore data. So as well as, when you tailor your questions, they must suit the language, of various populations, especially when you're dealing with vulnerable groups. And also, you should also be aware of the, non-Western health practices. So for people who are utilizing traditional medicine and so forth, you need to know that, what is being practiced in that area or in that, community, for you to not, now, disrespect or look like you're disrespecting other people's cultures. So it's quite important that you consider all those things, especially when you're designing your study and in-depth, and interview guide. Sorry. Okay, so again, just to touch on the ethical issues, so it's quite important that, you're quite clear with how you're going to, assure confidentiality with your participant, as well as, having them, sign an informed consent, meaning that you will explain the purpose of the study and why it's quite important. And from there, they will now be in a position to make a decision of whether they feel okay to participate in your study. But it's also quite important to make them know that even if you participate, you agree to participate now, it's still okay to, walk away at any time. This will also, ensure that you build trust with your participants and that they don't feel like you're taking advantage of them. So, there are various, tips for navigating ethical dilemmas, and, researchers may face ethical dilemmas such as when a participant discloses information that put them on or others at risk, such as, abuse or suicidal ideation. So in these cases, researchers, you can balance, your ethical obligation to maintain confidentiality with their duty to protect participants. So when you undergo, ethical training, this is a part where they will tell you. So in some cases, they tell you of the, when the risk, you have a risk benefit ratio. So when the benefit seems to be greater than the risk, you can, in a way, using your own discretion, take what seems to be, a benefit for the participant, so that, there isn't any further harm that will happen to the participant. So, for example, in this case, if someone is already thinking of, killing themselves, it would be, quite important that you recommend psychological counseling so that they can get the assistance, even though it means that you have to disclose this person's personal details. So you should always ensure that you develop clear ethical protocols for handling, sensitive disclosures. And you must always discuss this upfront with your participants, during the consenting process. So there's also, issues of data saturation and validity, in qualitative research. So data saturation refers to the point at which no new information is being gathered for additional interviews or focus groups. And here, saturation is quite important because it signals that the researcher has adequately explored the topic and that further data collection will likely yield redundant information. So Saturation typically occurs when the themes and patterns that emerge from data collection become repetitive. So this means that now no new information is coming up, and you're seeing that the same things which have been reported already keep coming back, meaning that the new interviews are unlikely to provide additional insights. This is why, in qualitative research, if a participant has, participated in a study of a similar nature, it's quite important that you do not necessarily invite them to participate, because therefore they will likely share the same insight for you. So it's always good to you know ask that question. Have you participated during your recruitment? Have you participated in a study of a similar nature before? Just so that you are able to get new insights. Right. So the techniques for ensuring validity and credibility involve, member checking. This involves going back to the participants after data collection to verify the accuracy and interpretation of their responses. So this is a process which usually takes place when now you have transcribed the data into words, and you want to make sure that, whatever has been transcribed is exactly as the participant meant. And then you can have issues of triangulations, which refers to using multiple data sources, such as methods or researchers, to validate your findings. For instance, combining interviews, focus groups, and field observations can provide a more comprehensive view of the research topic. And also peer debriefing. So this will involve discussing your findings and interpretation with a peer or a colleague who is not involved in a study, to ensure that bias is minimized and the findings are credible. So, research only gets better when the findings of your study are shared with other peers, who have expertise in the very same approach, so that you can see if there is anything that perhaps you didn't do correctly, or if there's anything new that's coming out, and therefore they can be able to help you, now, explain or interpret the meaning of your findings. So there's also quite useful tools and technologies when collecting your data, which can make your work, less strenuous or less painful, and also not time consuming. So there's also an issue of note taking. So taking manual notes, this is when during the discussion or during the in-depth interviews, where you will be observing non-verbal cues, expressions and things like that, that the audio recorder will not necessarily record. So these things, you can note them down to say that during the time when the participant was talking about this issue, they they showed signs of distress, or they showed signs of concern and things like that, so that you are able to now fully, recall when you're writing up your data or writing up your findings. So always use a structured format for notes. You should have a header for each question to ensure clarity and consistency. So audio recording. So, every time we have, focus group discussions and in-depth interviews, we will need to be recording the discussion. This is to make sure that nothing is missed. So you should always ensure that your recorder is a good recorder, and that will not, necessarily, not be clear when it's time to listen to the recordings and then transcribe the information to words. So in most cases, researchers are always encouraged to use 2 recording devices just in case the other one fails. So always ensure that participants are informed that you will be recording when you are engaging with them. This is just what I was talking about, that the recording will also ensures that you have accurate transcription of what was shared with you. So therefore, it's quite important that you familiarize yourself with transcription services, or there are people who are professional transcribers. There are also a technology that can help you with with transcription. Obviously, with issues like AI, they tend to get things mixed up, especially if the language that has been used is not necessarily English, this might be a bit difficult for you. So always using transcription services could be helpful for you in this case. But it's up to the researcher to decide on which tool to use for this to happen. So there are also various platforms that are useful, which are virtual, and when conducting, qualitative data collection, such as Zoom, Microsoft Teams. There are other specialized platforms such as Remo or VFS. Um, and utilizing these tools is quite important and is also very useful, especially if we're going to be interviewing or having discussions with people in remote areas, so people you cannot necessarily get to. This could be very useful. But of course, the dynamics of managing this is quite different. And also you need to look at accessibility issues that participants would have so that you don't necessarily exclude them due to that they are not able to access them. So also during times when visiting participants is not possible, such as the time when we were under strict lockdown during COVID, such platforms were quite useful for gathering data. These were not only important to respect the regulations, but also for the safety of the participants. This means that you minimize any sort of spreading of diseases, so that for you still get to have your discussion or your data collection, but then the safety of the participants is always ensured. Obviously here you will have to ensure that everyone has access before you can actually choose which tool to use. So this was a question that I would have loved us to take. So I see that our time is up, but if the audience is happy with us undertaking this activity, I would be happy for us to go through what different groups would come up with, especially designing their own semi-structured interview guide, because this is the critical part for data collection, and this could be useful when you know how to do it. So if we can get an opportunity, maybe just go over a few minutes so that we can just undertake this activity, if that's okay. Thumbs up will be good. Great. So I see a thumbs up. So I'm gonna put oh sorry, it seems like I moved my slides when they were not supposed to be. So I'm gonna put the question and then we can just go through it. From there, I think you can put one or two questions each, and then we can just go through those questions. Khumuto, I can't seem to navigate my slides anymore, so I can put my, am I still in control?
No, your slides are not moving.
Yeah, okay. Seems like it's working now.
Yeah.
Okay, great. Great, so this is the activity that I would like us to have a small discussion about. So if we can have like 5 minutes or 3 minutes rather to just have discussions. Kumoto, can I be able to create breakaway sessions here?
I'm not sure, but you can try. I'm not sure though.
Yeah, sorry guys. I want to try and find the option. Pardon me for that. Yeah, I don't see the option. But Anyway, since we are not able to create breakaway sessions, maybe what we can do is that everyone can just post on the chat maybe one question that they would have as an introduction, core question, probing question, and a closing question. That would be quite good so that we can have some discussion around that. It will also be very good, to see any questions that the participants or the audience would be having so that we can respond to them after the discussion on developing a semi-structured interview guide. So feel free to share on the chat box, please. Great. I'm seeing that quite a number of responses are coming through. And I'm quite happy that it seems that all of you seems to have captured what developing a semi-structured interview guide or posing open-ended questions should be like. So I had already prepared a guide of my own to help you or to assist with this activity. So I would like us to go through it while also looking at some of your responses. And perhaps here we can, have discussions, at least for 5 minutes just to, get your own opinion on what else you think could be useful when developing this instrument. So on my interview guide, these are the questions that I put as an opening statement. Can you tell me about when you were first diagnosed with your condition and how it impacted your life? And then my core questions were, what treatments or medications have you tried for your condition and how did you feel about them? How does your condition affect your daily activities of work or routine? What roles does your family or social support play in managing your condition? And then I said that my probing questions would be, you mentioned you had difficulty with medication side effects. Can you explain more about how that has affected your day-to-day life? Also, how do you feel about the advice or care you receive from your healthcare providers? And then a closing questions, what do you think could improve the experience of living with your conditions? Those are some of the questions that could help you get an understanding of how this person has been ever since been diagnosed with the conditions. So I'd like to open a platform for a bit. Maybe one or two of you can share your own views on how you think this can be useful for you when developing your own tool to interview participants. So maybe we can see some hands. That would be good for those who have something to share or a question. Okay, now just looking at the chat box, I'm seeing that there's a number of questions added. So Rosaline added that, hi, my name is so and so, okay? And I'm conducting a research on physical educators teaching and assessment experiences during COVID-19 pandemic. Yeah, feel free to express yourselves. There are no right and wrong answers. Great. So that's now touching the, ensuring that the participants should not feel like what they're sharing, will have any sort of negative effect on them. Oh, sorry, it keeps moving. Yep. There's no right and wrong answers. And then she starts with the questions. How long have you been teaching physical education? Yeah. So now you want to get details of how long they've been, undertaking that specific activity and how did you experience teaching during pandemic. So now you want to capture views on the pandemic, the experiences, whether it affected teaching and whether, there was any feeling towards the pandemic how long how did you experience teaching during the pandemic? And then a specific question, she puts that how has teaching during the pandemic affected your assessment practices? And what forms of assessment practices? So what forms of assessment practices could come after as a probing question. That means that if you ask if COVID has affected or if the pandemic has affected your teaching practices, therefore you can allow the participant to now, share, what teaching practices they might be having. And from there, if they do not touch on issues of, these are the teaching or the assessment practices that they, engage in, therefore you can put that as a probing question. That's another way you can be able to sort of like structure that. I saw a hand up, but I see that it's gone now. I'm not so sure who that is. So I would be happy if that person could ask a question or put a comment on whatever that is that they wanted to raise. Okay, so I see David asked a question. So earlier on, you mentioned about piloting the interview guide. Question is there a formula for determining the number of participants to pilot the guide? No, there's not necessarily a formula. Remember, with qualitative research, we do not have what we call sample power. And the findings that we would get, we do not necessarily, generalize them. Testing or piloting the question is mainly to see that the questions that you are using will assist you in capturing the insights that you're looking for. So this is, now checking for clarity, also checking for language issues that, they don't necessarily mislead people. And, they are also easy to understand. So yeah, that is the main reason for doing that. Okay, great. Muyahabo also asked another question. Is there a number of participants to determine if there is data circulation? Yes, so I would like to say that there's not necessarily, so remember qualitative research does not rely on statistical, or numerical data. So therefore, we will not have numbers determine if there is enough of anything. But saturation is mainly when you get that the insights that are that they are coming are no longer new. So this means that there's now a repetition of information. Participants are sharing the same things that you've already collected. That means now the saturation has been reached. So in a way, they will tell you that when no new emerging information is coming, then you should know that data saturation has been reached. I hope I've put it in a very simple way. Fantastic. Any other questions before we can proceed? Okay. So yeah, fantastic. I think we sort of have covered most of the details that talks to qualitative data collection methods. And I would like you to take into consideration or take in mind this, key issue. And number one, that is, qualitative research is quite vital for exploring patient experiences or, individual experiences or people's experiencing. And that is, in relation to understanding the cultural context and uncovering social determinants of health. And it allows researchers to understand the subjective experiences of individuals and groups. We say subjective because this is mainly a report from the individuals involved. So this means that we give them the power to express how things are affecting them rather than us necessarily just saying this is how people are being affected by certain things. And this is quite important, especially if you consider giving voice to populations that may otherwise be overlooked. So, people who feel like, most of the things that are are discussed don't necessarily involve them, or they feel like, the society doesn't consider them, their issues, or consider the things that are affecting their lives. Qualitative data collection methods, will involve semi-structured interviews. And these interview guides have to provide flexibility to explore personal experiences such as, chronic management, while ensuring that the conversation stays focused on the research objective. And when conducting focus group discussions, you have to understand that you use this, or when to use this is when you want to understand community perceptions and require careful attention to group dynamics to ensure all voices are heard. However, when you now want to provide, valuable insights into personal health journeys, that's, for example, living with obesity or living with, a heart condition, you would require to build rapport, and have some, sensitivity when questioning participants with regards to this. So this means that in-depth interviews are more personal. So therefore, even the way or the line of questioning has to be, or has to take that sensitivity approach to ensure that your participant feels respected and feel okay enough to share their insights with you. There's also, issues of considering, cultural sensitivity when you are asking certain questions, because, some cultures have beliefs that could actually oppose some certain, aspects that would be required, or some would consider Western medication or Western medicine. So it's quite important that you are knowledgeable in with such things, so that you do not necessarily infringe on other people's cultural beliefs. And also, issues of ethics are quite important when you are going to engage with participants, because you need to ensure that whatever they're going to be sharing with you is going to remain confidential, and that nothing will actually, put them in any harm's way, once you publish your data. And also, it's quite important that your participant has to feel that this is going to have like some sort of impact that is going to positively influence, whatever that is going to come out after you've reported your findings. Um, so issues of data saturation. So, knowing when, to stop, collecting your data, because now data saturation has been reached. And also the issue of validity. So ensuring that, your findings are meaningful, credible. You need to adhere to those, quality assurances, which is member checking, triangulation, which can help, strengthen the credibility of your research. So remember, it's quite important to show that, you've taken the necessary steps to avoid bias as much as possible when reporting these kind of findings. Also, familiarizing yourself with technological tools that can facilitate or assist your data collection, such as using virtual platforms, interviewing tools such as audio recorders and transcription services. Those will actually help you, be able to prepare your data and get it ready for analysis. And then there's also issues of data privacy. So who gets to access the data and data security. So this is after you've now collected all the data, you've now recorded your audience or your participants. There's a need for you to show that, the data will be kept safe, and that, you will not find a recording. This nowadays, we have so many, videos showing on social media or recordings showing on social media. A participant sharing their own experiences about GBV would not want their audio on Facebook or on Instagram or Twitter or TikTok, because that would be quite offensive and that would be detrimental. So therefore, you should always ensure that the data that you will be collecting for them will be kept safe, and you should share with them the details of how that security is going to be maintained. Right, so we just added some resources that I thought could be useful. for you to, further read up on, qualitative data collection methods. And, I hope, you'll be now in a position that will assist you, to start preparing, especially when you're designing or developing your own interview guide. And, knowing which approach or which methodology you're going to use, whether it's in-depth interviews or focus group discussions, and you now fully understand the, instances where you can get to use, in what situation do you get to use, a type of approach. So from me, I would like to say thank you so much for your participation, even though we've gone a bit over time. And I would like to appreciate your engagement throughout the talk. And I hope that if you have any questions, you will feel free to use my details as I've, included in this last slide, for you to ask any questions that you would like some clarity on. You can also feel free to, post some questions on the chat box, and I will gladly respond to them. I thank you.